Yes, thank you very much, and I'll echo the thanks for your presentation. Before we get into questions from the board, we do have one deputant. His name is Danielle Freedom, and I understand this is an online deputation. So with the help of technology.
There we go. I think I'm on.
Oh, there you are. Great. This is working.
Great.
Okay, welcome, Danielle. You have 5 minutes for your presentation. We welcome it.
Thank you very much. My name, as you know, my name is Daniel Freiheit. I think they had it there as freedom. That's the same term, just the German version of freedom. I'm a Toronto resident and a father of 4, and I actually applied to be a public member of this board, and hopefully the councillors have had a chance to review my bio. But that's not the purpose of my delegation today. But first of all, I want to thank all of you for your service. I know it is a thankless job. And it's a stressful job, and it's a darned if you do, darned if you don't kind of role. So your service and commitment and your dedication is acknowledged. The reason I'm here today is to ask this board to address ongoing COVID vaccine mandates in particular that much of the public is unaware about. Many folks think that the COVID mandates were dropped when the province, the cities, and the federal government dropped them, but surprisingly, many private and semi-private institutions have kept them in place. And I recently learned, including the City of Toronto, based on a recent arbitration decision. And the irony is that these mandatory vaccination policies are actually, at this point, in my view, and based on my experience dealing with a lot of members of the public, is that these are detrimental to Torontonians' well-being. And I just wanted to see by a show of hands who on this board is aware that there are still schools in the GTA that require children to get vaccinated with the mRNA vaccine in order to attend an independent school. Just wondering if the board was aware of that. Okay, I'm not seeing a show of hands, but it's possible that this is not interactive as I thought. And can I see just by a show of hands who on this board is aware that some employers still have a policy? Well, I guess you're all aware of this because the City of Toronto still has a vaccine, a COVID vaccine requirement for employees. And I'm assuming you all knew that this policy is still in place, just by a show of hands. Yeah. Lastly, I wanted to see by a show of hands who on this board is aware that that the impact of the Pfizer vaccine on subfertile individuals remains something that, quote, needs to be urgently studied. And this is according to a recent journal in Andrology in June 2022. So the issue is that these vaccines are having side effects that weren't exactly anticipated when they were initially rolled out. And this is through real world data that's now coming out. And it's important to balance those additional incoming information as this board promotes additional vaccination, but especially for this board to speak out against ongoing mandates. I think this board's policy, or the goals of this board, are to maintain and improve the health status of Toronto's population, and 2, to reduce inequities in health status. And I believe that the board can take 4 important steps to fulfill its mandate today. First of all, I think the chief or the associate medical officer needs to issue a communication immediately clarifying that the vaccine does not stop transmission. I think this is a point of confusion that is resulting in a lot of ongoing mandates in schools and independent schools and in workplaces, including the city's own workplace. The arbitrator in the decision that I just learned came out. The arbitrator was using a will-say statement of Dr. Dubé that's very outdated. We now know that transmission, and Dr. Finkelstein confirmed it this morning, the vaccine does not stop transmission, and many employers are issuing mandates on the hope or the belief that forcing all their employees to get vaccinated will stop workplace transmission, but it's not doing that. And employers have to focus on other methods like flexibility with remote work and improving air quality in workplaces. 2, I believe this board should communicate to the Ontario Federation of Independent Schools that COVID vaccine mandates for children is not a policy that is supported by public health at this point in the pandemic. 3, I believe this board can issue a communication to private companies and institutions that workplace vaccine requirements, although advisable, should not be used to exclude unvaccinated individuals from employment or education just because not only because there are unknown impacts on subfertile individuals that require urgent study, but because this type of exclusion is creating a massive social rift and is detrimental to public health. Last but not least, I believe this Board of Health should be communicating with the College of Physicians and Surgeons of Ontario and the Minister of Health as a backstop to ensure that the medical exemption guidelines that were published originally in January of 2022, those guidelines need to be relaxed. Many doctors who would otherwise provide patients with medical exemptions are confused by these legacy exemptions.
Danielle, can you wrap it up? I'll give you 15 seconds to wrap it up.
Yeah, those guidelines just needs to be updated to make sure that those who qualify for exemptions can be provided for them. Thank you very much. If there's any questions, I'm available anytime to respond.
Great. Thank you, Danielle. Are there any questions of the deputant, either from folks here or online? Seeing none, Danielle will just say thank you for your deputation. Much appreciated.
Thank you very much.